Get ahead in your career, improve your confidence, and really just make you happy. All of those possible with a great smile.
And the doctor who can help make that a reality is joining us now, Dr. Thomas Sepik with Laser Cosmetics. Such a pleasure to have you here.
Thank you for inviting me.
Of course. So we're talking about cosmetic dental care. What guides that when it's given to patients?
There are two things. I always say reciprocity is the beginning of this whole process. Our patients have developed their interest in dental work over a lot of time. And a lot of our patients have had problems with teeth. So for cosmetic dentistry, it serves two purposes really well. Number one, it provides people with protection. Number two, beauty.
And that's what we're all seeking, right? That's what everybody, everybody wants a great smile. Everybody wants their teeth to be white.
And it's easy.
Okay, so why do people come to you? You say it's easy.
They come to us because of the reputation we've developed in Nogales. We do 125 Americans per day.
Wow.
We have 25 doctors. We have a laboratory. We have technology that's far beyond or exceptionally good, way beyond what most people expect.
Well, it is certainly beautiful.
Definitely. We've talked about that. It's cutting edge. It really is the best of the best that you can get. It's the future, really, of dental care. And so let's expand a little bit more on how cosmetic dentistry actually protects teeth. And then we'll talk more about how it beautifies it, too.
The protection part is unique because what most of us don't realize is, unfortunately, as people age, teeth wear out and they fracture. The bottoms of teeth, especially those in the front, if you look at that slide, you can see the line drawn. That was the normal place of the teeth on this person's mouth. That's where they were before we began. And you can see that dotted line doesn't look much.
It wore way down over the years.
Way down.
Yeah.
Unfortunately, it's the fractures that make the real problem. Fractures, when the teeth split, they are no longer capable of sustaining the impact. So what the actual veneer does, it's a very thin porcelain coating, but it's actually done like a crown. So the crown is on the front of the teeth and it wraps around the very bottom of the tooth. So the biting that takes place now has been protected. We're not going to hurt those teeth anymore. They're going to be kept long, and also we can change the shape of teeth as well as color.
Well, she certainly looks beautiful with her brand new smile.
Yeah.
Well, yes.
She did, and you can tell that the radiance, here she is again, the radiance of the smile, you can see it in her eyes. Again, confidence is a word we use a lot, but it's true, you can see the confidence.
Well, if you notice, the pictures aren't much different in time. They're really not. On the right-hand side, the smile looks so much dramatically different than the one on the left.
Right.
They are different teeth.
And even the way that she's standing and her head is, you know, you can see the difference.
Absolutely.
Well, it's a confidence issue as well.
Right.
It enhances your social networks as well as your own opportunities within the work world, for promotion even.
So when does a person know that it's the right time to seek this type of care?
When they say to themselves, boy, my smile doesn't look good.
Or it looks a little bit different than it used to.
Well, what's really surprising is how often patients at the clinic ask me, what can happen as a result of this? What can change? And the teeth look very bad. They're not good at all. So it forces me to be considerably more interested in what they ask as a question. And I can usually bring it up and then talk about it. And once they hear it, then they truly believe that that's the next step for them. It's time to begin the process.
Right. Now, we just saw up on the screen right now the Children's Miracle Network. Explain how you're involved in that and why you decided to choose to.
Okay. Like all things, because we have so many patients, those patients have come to us because of the way in which the quality of the product has developed, as well as the reputation we've built, and they tell their friends. So we don't use advertising to bring our patients in. Only those who have been at the clinic come. Children's Miracle Network is a way to give back to the community, give something back to kids. And I told Matt that I've had diabetes for 48 years on insulin. So I wear this pump. And because of that, I realize how important it is to have others who have helped me along the way.
Right.
So that's our way of showing that we can help them in this way. We will give every single person that comes to us in the next 2 months, April and May, we'll send $200 to the Children's Miracle Network, And if there are 50 people in 2 months, that's $10,000 that will give the Children's Miracle Network hospitals.
Well, just an added incentive, as if it wasn't enough that you're making us look better, making our smiles more radiant. Now you're also giving back to this really great cause. And Doctor, thanks again for enlightening us with this brand new technology and for being here today. Nice to see you.
Thank you. And if you're interested in improving your smile, you can book an appointment with Dr. Sepik. You can find out more information by going to nogalesdentallaser.com.